Welcome to another edition of Think Tech Hawaii's Education Movers, Shakers, and Reformers. I'm your host, Carl Campagna. Today we have a very special guest, special to me in a number of ways. We have the opportunity to talk with Ms. Georgi DeCosta, the Executive Director of Hawaii Meth Project. We know that drug use is a problem really globally. We know in Hawaii there are a great many issues, and we see our kids go through the challenges that they're faced with, and that the availability of drugs, really specifically dangerous drugs, is really much too prevalent and much too accessible. So it's really a topic that needs to be addressed really on all levels, from education, from teachers, and from principals and the programming there, to programs such as Hawaii Meth Project. One of the most important aspects as well is to make sure it gets reinforced at home, that we are reaching to the parents and that the parents are helping in this conversation as well. So with that, let me welcome Ms. Georgi DeCosta. Thank you so much for being a guest.
Thank you so much, Carl, for having me.
Very happy to, very happy to. This is an important topic. It impacts education for our keiki. And it impacts it in ways that is, well, on all levels, really. It impacts them because it's a social thing, right?
Yes, it is. Yes.
It's also, because it's a social thing, it reaches into the family, then it reaches into their education, what they're able to do in classes. And
as well as economically.
And economically.
And exactly. So is it taking away from our state and our businesses and our families economically, whereas our children are suffering, yes. You know, in various ways. I'm so glad to be here to have this conversation with you.
Well, thank you. I'm glad that you could make it today. For starters, what is the mission of Hawaii Meth Project?
The Hawaii Meth Project was started in 2009 here in Hawaii to reduce first-time meth use amongst youth, 12 to 24 years old. So we really are targeting those in grades 7 to 12, first and foremost. And then we also reach into the college age, but not necessarily only college students. But we spend most of our days in middle and high schools across the state of Hawaii. And right now we only are a staff of 4, which is actually the largest staff we've ever had. Wow. We are a nonprofit organization, really relying on grants and contributions from people just like all of you out there.
Yes, well, excellent, excellent. That's a huge undertaking, huge undertaking. So tell me a bit more about the leadership. You're executive director, congratulations to you.
Thank you.
Who else do you have on your staff?
So we actually are 4 women right now, powerful women. Myself, I've been with the organization for about 3.5 years now. For the first couple of years, I was the program director, and for the last year or so, I've been the executive director. We have our prevention education manager, Tanya Harden, who has over a decade of experience in adolescent treatment, substance abuse treatment and prevention, outreach and education. We have Amanda Ung, who has a wealth of knowledge in social media and outreach and digital engagement, who runs all of our online engagement conversation, and then Chelsea Chow, who is our communications and development manager, who is an amazing, make sure that we all look and sound very good.
I know how important that can be, certainly even for this show. Interestingly, my daughter often does my makeup for me to make sure that I'm not glistening.
Excellent.
I know how that goes. So. We missed that today, so sorry. Okay. So how long has it been in existence, has Hawaii Meth Project been in existence in Hawaii?
So that is 2009, so we're going on almost 7 years. June will make 7 years. It actually started in Montana in 2004, the Meth Project nationally. And it really started with one man, a wealthy philanthropist, who saw the need in the community. And he was extremely busy. A tech philanthropist, actually, is a businessman who said, what is going on in my community? What's all this theft? And he had a close family friend who had a son who was going through meth addiction. And he took notice of it. He did his own research and he said, we've got to do something about this. He put over $20 million of his own funds to invest in the commercials and all of the initial research that went behind the Meth Project that we may have remembered from the online commercials and TV advertisements. And from that, he reached out to friends in the business world that he saw around him, and he said, hey, you know, I think in your state there might be a need. Maybe if you started, you invested in a nonprofit in your community, you might see some results. Because in Montana, they did see good, amazing results. They're still battling every day to this, till right now, they're still an ongoing organization, still preventing and providing awareness. But this is an ongoing effort. So we were a lucky state that were benefited from one of those investments from a local philanthropist, a part-time resident who remains anonymous, and he saw the need in Hawaii. And Hawaii remains in the top 5 for meth-related treatment emissions. We cannot get out of
top five as far as the need?
Top 5 for meth-related treatment emissions, meaning that we number 1, number 2, number 5, back up to number 1. We bounce around the top 5. We're back up to number 1 based on the latest federal statistics.
So this is another economic challenge, because immediately they're all going to the emergency room, or many cases anyway, to the emergency room, which ends up being a taxpayer cost in that regard.
Exactly.
Not to mention, many people end up, if they're not already, they end up homeless as well. So it's impacting, and then gets prevalent in there. Have you? I know that doing some of the research for this, I noticed that a lot of what you do is very research based and really research oriented. Can you tell me more about how that comes about and where that research comes from, or what groups you work with in order to try to pull some of that together?
Absolutely, and really much of that research came from that initial investment from that first philanthropist. And he got the best experts in the fields of neuroscience and addictions. And so that's where all of our programs came from initially. And locally, we do our continuing research for our states and our communities to apply that work and that the curriculum to our communities as appropriate, because Montana, Idaho, Colorado do great things in their communities, but we all apply it just a little bit differently, because as we all know, Hawaii is just a little special. And so we, the team of our 4 wonderful women, we apply the curriculum as appropriate to our communities in Hawaii, and each community is unique in itself.
Each community, each culture has their own sensitivity needs and their own cultural background that you have to be sensitive to and be understanding of.
Exactly.
So that's, I guess, one of the challenges.
Yes, but really, when we're talking dollars and cents, it costs us an estimated $500 million in the state of Hawaii. So that's, you know, the methamphetamine use.
It costs the taxpayers.
All of us, not just the government. So this is a RAND study. So you're looking at incarceration, law enforcement, medical, emergency room visits, foster care, loss of productivity on the job, workers' comp, all of these things that come from related to methamphetamine use in the state of Hawaii, in 1 year can be as much as $500 million.
Wow. That's a lot.
That's a lot of money. And how could we be applying that to our families and our children in a more productive and positive way?
Yeah, that is exactly that. It's productive, it's positive, and it's keeping families working together, keeping families really marching towards the family goals, right? So family goals, making sure education is there, making sure that we are getting our kids into school, from kindergarten or pre-K, which is a huge, important issue as well, pre-K, which sort of leads me to my next thought. You had mentioned you're going in really 7th grade. What made the determination, or how did you come upon 7th grade, not 6th grade, not 8th grade, or not 5th grade, for example?
So we go in at 7th grade because our, I don't know if the viewers have seen our ads, they tend to be a little more hard-hitting. The content is a little bit more controversial. So although I have to say we have brought our local program and curriculum a long way from just the advertisements, that is really just the attention grabber. And then from there, our classroom education is so much fuller than that. I invite anyone who's interested to reach out to us if you'd like to, observe a classroom presentation, because we really want to have a conversation. And the other reason really is to, at 7th and around 9th or 10th grade, these are when health education has a drug lesson format
lesson for it.
Plugged
Okay.
in.
Okay.
Yes, in some areas we will go in at 5th or 6th grade if there is a need, and in some school districts there are programs that actually have us come plug in at a 5th and 6th grade level, because there is a weed and seed or a special programming that we do adapt our presentation for those students, and we're happy to do so.
Okay, and is this sanctioned or in coordination directly with the principals or the Department of Education, or how does that work?
It really is through champion teachers. Teachers have these benchmarks that they have to meet through their health core curriculum, and the health teachers reach out to us and say, hey, I'm teaching our drug education, and I would love for you to come and help to present in this meth specific area, because in our community it's a real need, it's a real problem.
Yeah.
So they invite us in. So
it's teacher specific, it's not
really
programmatic. So DOE doesn't get in the way. Department of Education doesn't say no, don't do it. They don't have a problem with it, but they also don't have a program to run it and to make sure that it's in every classroom appropriately.
yes.
Interesting.
Yes, and we do actually have an online lesson that was finished and released for the general public and for these teachers who maybe we can't reach them with our staff time. It's online, methpreventionlesson.org. You select Hawaii as your state, and you can provide the lesson yourself. All the resource materials and the lesson guide is there for you if you're a teacher that would like to do that.
I would like you to come.
Yeah.
I have to be honest.
Yeah.
Tell me more. Let's we can perhaps end this little segment with hearing about the Teen Council.
Oh gosh, the Teen Advisory Council is really the shining star of our program. Everyone thinks that our presentations is why we exist, but the staff and those closest to our program know that our Teen Advisory Council are truly the superstars, because we recruit high school students from across the state every year in the spring, and we about 20 of them are selected. Last year I think we had close to 30 applicants, and we ended up with 19 that were selected based on their application, their interview. They had to come with business attire, like a real job interview, and 2 letters of reference, because we want them to really be prepared for the next level of their life. It's a real life skill. And they were selected based on their passion, based on their preparedness, for representing to be an ambassador for the Hawaii Meth Project. These teens go through intense training. They went through 4-day leadership camp with us, public speaking, project management, media training, intensive drug training with the best drug trainers that this state has. And one of them is world renowned, Gary Shimabukuro. He trained the kids for 2.5 hours, and the kids wanted more. They got so much out of it, and by the end of the time, they were already walking away with their plans for the year. They each have.
They're motivated.
They were motivated. They're requested to, tasked by us to do 2 projects, at least one in the school and one in the community. Most of them do many more than that, and we're so proud of them.
Love that. Inspired. They get motivated and they want to reach out and do more, and that's growing community. That's important. And that's a huge component of what I think, certainly these days with media, no offense to the show here as well, we lose some of that community connection sometimes. So I think that's wonderful.
One, they know their community better than we do, because
Yes.
each school is different. We have a menu, a list of activities that we can do in schools, but it's not a cookie cutter. So the students really have to come to us and say, well, I think number 6, number 12, number 3 will work in my school, because they know what's best.
Wow.
And they help us craft it.
That's
and
excellent.
that's how we have become successful. It's really through the youth leading these outreach efforts.
That's excellent. That's excellent. Last quick question. 19 kids selected last year on every island, or was it more focused on one island or another?
So we have 11 on Oahu, we have the rest on neighbor islands. We have 2 Kauai, 3 Maui, 1 Lanai, and then a couple on the Big Island.
Okay, excellent,
Yeah.
excellent, excellent. We are going to take a quick break, so please stay with us. It will only be about a minute long. Once again, I'm Carl Campagna with Education Movers, Shakers, and Reformers with our wonderful guest, Georgi DeCosta. Thank you.
Aloha, this is Kaylee Akina, president of the Grassroot Institute, and I want to thank you for watching Think Tech Hawaii. We are delighted to be partners with Think Tech because it gives us the opportunity to bring to you a show every week on Monday at 2:00 p.m. called Ehana Kako. Ehana Kako means let's work together, because we believe that Hawaii will be a better place when everybody works together. And in what way? Well, at the Grassroot Institute, we research 3 basic areas, and we invite guests to come on board from across the country, the state, and the nation to talk about a better economy, a better government, a better society. Now, aren't those things we all want? Indeed. If you'd like to have the latest research in terms of public policy, as well as ways in which we can build a better government, economy, and society, then tune in every Monday on Think Tech Hawaii at 2:00 p.m. for our fascinating guests on Ehana Kako. Let's work together. I'm Kaylee Akina with the Grassroot Institute, and I'll see you then. Aloha.
Aloha, welcome back to Think Tech Hawaii's Education Movers, Shakers, and Reformers. I'm Carl Campagna, your host, and once again we have Ms. Georgi DeCosta from Hawaii Meth Project, so thank you again for being with us. Right off the top, so you told us how long you have been with the program, and about a year you've been the executive director.
Yes.
What drives you?
What drives me? Really, what drives me to do this work every day is the kids, is the students. I have my own personal story of addiction, and it's been 16 years off the streets for me with meth and heroin. My kids went through foster care. They, a few years back, they lost their father to addiction. He never was able to get out of it like I was. And I've seen firsthand how much destruction drugs can do, but specifically meth. Meth, more than any other drug, can destroy a person, mind, body, and soul. It really is unlike any other substance, in my opinion. So when I go out there, I'm really driven to share that with the students. We take the information, the facts, the science from the Meth Project National, and we take testimonials, real stories, real heart, and we try to wrap that all into our educational program to kind of present to the students the package of this is why we think you should not try meth.
So you bridge the heart and the head.
We bridge the heart and the head, and we present it to them. And it's not, don't do it because we said so. It's really, we present to you what we think. What do you think? And then we try and have that discussion. And really, I am driven to try and show hope. We're all trying to be a beacon of hope, because so many of these kids out there they're growing up in these...
For every reason possible.
Yes.
Maybe they're homeless, maybe they're just low income or no income. Who knows what their cultural conditions are and how they got here to our shores. All of these conditions and how expensive it is to live in this state, to be able to just get through day to day can be very defeating.
Yes, And so just, we try and show them through volunteerism, through all these different, get involved with us, just come in and hang out with us and you'll have fun. And maybe they'll build their self-esteem. They'll just be away from the negative for a little bit, and grow and just have a little respite, in that time with us.
It's breaking a cycle.
We're trying to break us, and it's not really us, it's the Teen Advisory Council and the teens that volunteer with us, that they're the ones that are doing that. And, honestly, Carl, I've been in classrooms more than once where students have stood up and said straight up to my face, well, my whole family gets high. Who am I to say that I'm any better? I'll be the same like them. And they truly believe this. So, my response to that is, well, if your dad was a plumber and your grandpa was a plumber, you cannot be an electrician.
Seriously, exactly.
You can still love them and make a little bit different choice. And maybe they'll see that there's hope for them too.
Yeah.
It's okay.
As you know, my wife Sharon and I, we're foster parents.
Mm-hmm.
So we have seen what some of these kids go through.
Yeah.
And what some of their experiences are, and what when they come to us and we just get to know them a little bit, we find out what they think life means, what they think they're supposed to do, and who they think they're supposed to be. And sometimes that's the most heartbreaking moment, when we realize that this young 9-year-old girl thinks that all she is supposed to do is be a mom and learn nothing other than how to take care of their baby.
They take on the weight of the world sometimes, and it's been a blessing, for us. Our team really sees it as a blessing to go out and do this work, because we get to be that beacon of hope for some of these kids, and even if it's just for a glimmer in time.
So your hope is to bring that hope.
Yes.
Is to make sure that you are shining the light of hope, so that they can hopefully fly to it.
Yeah, so that they
and
see
cling to it.
that sparkle, that shimmer, and they think, wow, maybe
there is an alternative.
Yes. And
I don't have to be this. I can be more.
Exactly, because really, Hawaii Meth Project is not the be-all, end-all to the meth epidemic. Not at all. Really,
But it's necessary, because if you don't have the conversation, if you don't have the conversation with your peers, if you don't have the conversation with your authority figures in school, your teachers and your counselors, if you don't have that conversation, maybe most importantly, with your families. I know we were talking about that a few times already.
Yes.
Having that conversation with your parents and with your siblings or cousins or whoever, to make sure that, you know what, this is what's going on, and this is what I'm being presented with, and how do I deal?
Yes. I really see us to be a catalyst.
Yeah.
And communities, families, they really have the power to heal themselves. I really, truly see that. And the smaller, the more remote communities are extremely powerful within themselves.
Oh, yeah.
And over the past year, we've seen meth coming up in some of these smaller communities across the state. We don't see the data yet because it's still very fresh. We anecdotally see meth use on the rise. There's also prescription pills and heroin, opiates on the rise as well. It's extremely heartbreaking, but the communities are rising up. So Hawaii Meth Project coming in is really just a catalyst, and to support the safety net in that community or that family or whatever it may be, and then we step away. And so we just and they heal themselves. It's very cool to be a part and see that.
Imagine one of your team members, along with the teen council, has been able to reach one student, one 7th grader, one 8th grader, and then that 8th grader takes that home.
Mm-hmm.
And the opportunity to have that moment lead to more moments that can help the family heal.
The ripple effect is amazing.
Yeah.
Yeah, and that's what we truly see happening. And we have over 1,000 teen volunteers statewide every year.
Wow.
Because they have so much fun. Even the kids that come up to us and say, I have to be here, school made me come, my mom made me come, I have to do service hours. Most of the time, by the time they're done, they're having so much fun. They're like, Auntie, when's the next event? Auntie, when's the next thing I can volunteer for?
Love that. Love that.
I have
that's
so
that's
much
a credit. That's a credit to you and to your team.
Oh my gosh.
So,
And it's a
thank you.
credit to the Teen Advisory Council because they make it fun. They make us look good.
Well, I would look forward to meeting some of them someday.
Oh,
So
yes,
I'd very much like
yes.
to. Real quick, I would like to. You talk about how meth infiltrates and is such a negative draw. We hear about, oh, it's it's one of the worst drugs, all that. How? What is it? What does it do? Without getting too deep, perhaps, what does it do and how does it do that?
You know, I think it's a mix of the situations that come with meth use. I mean, if you think about the fact that someone's not sleeping, not eating, and it's jam-packed full of harsh, toxic chemicals that don't belong in a person's body. If you don't sleep and get proper, nourishment, after a few days, aren't you gonna?
You're sick.
You're gonna be sick, and you're not gonna be in your right mind, and you're gonna be, probably fly off the handle. You could be short-tempered. You're gonna be not thinking
irritable,
straight.
and,
So imagine all those things and multiply them. The longer the person is using, and the longer the person is not sleeping, eating, is the more the person is ingesting this drug or taking however they're using this drug. It really is. That's just the tip of the iceberg for someone to kind of understand.
Yeah.
And then you add the lifestyle of the kind of the society, the lifestyle that comes with all of that, which can really do a lot to a person to change them.
Your decisions are colored by it. You make choices for the drug instead of for yourself, instead of for your family or for your friends.
Absolutely.
And because it becomes more important.
The drug becomes all important, and it's unfortunate, that is the case. And I think, Hawaii has 4 times the national average for meth in the workplace. So Hawaii workers, even when DLS says that Hawaii, meth kind of went down last quarter, which the most recent numbers, they did report that. And I think their kind of comment on it was, but we're still 4 times the national average.
Wow.
We have a long way to come down from that.
Yeah.
We're very, very high up there. So what that tells us is that we have a lot of functioning meth users.
Which is hard to even
Fathom.
comprehend.
Right?
That you would be a functioning meth user.
So people are on the job,
Wow.
and I don't want to lay that on just the blue collar, because a lot of times the people getting tested are blue collar. We do hear anecdotally a lot of white collar.
So it doesn't have a preference. It's wherever.
Meth use does not discriminate. It is very expensive to live in Hawaii. I think we need to love everyone around us and be very cautious and look out for one another. And that's what we actually tell our students in the classroom. We're never responsible for anyone else's behavior, but we can look out for one another.
Yeah.
And we can speak up if we see a change in behavior, because you never know. It may not be even meth related, but if somebody's going through a hard time, you can reach out and say, hey.
But that, to me, that's a Hawaii value, that we are here with our brothers, with our cousins.
But it's also Hawaii value to mind your own business. And so we have to weigh those two very carefully. So sometimes we think, oh, it's not my business, it's not my place to say anything about what's happening in someone else's house or family. But, it's not about a judgment, and it's very cautious. Of course, we don't want to get in anybody else's business or pass judgment.
Right.
It's not about that.
Right.
It's about reaching out to someone you care about. Say, hey, I miss you. I'm your friend. I'm here for you.
Yeah.
Let me know if you need to talk. That's it.
And until an intervention, perhaps, if needed.
And there's professionals out there that if you need help. There's Hinamaka, there's Salvation Army. There's a lot of resources out there in the community.
Yeah. Okay. All right, we're going to take another quick break. So again, thank you. This is Think Tech Hawaii's Education Movers, Shakers, and Reformers. I'm Carl Campagna, and this is Ms. Georgi DeCosta. We'll be back in 1 minute. Thank you.
One.
Aloha. Welcome to Think Tech Hawaii. My name is Josh Green. I'm a senator from the Big Island and a physician. I host a show weekly called Healthcare in Hawaii, where we talk about the most important issues in healthcare for our state, whether it's the dengue fever outbreak, the state of our public hospitals, how to find physicians and nurses for our patients, or really just the best things to do for our family's health. That's what you'll find on this show. I'll bring experts to your attention, and we'll have a free-flowing dialogue. Thanks for joining us.
Aloha. You can join the Hawaii Farmer Series every Thursday from 4 to 5 on Think Tech.
And I'm your co-host Matthew Johnson, here with Justine Espiritu.
And we are so thankful to have this show to use as a forum to get to know all the movers and shakers in agriculture in Hawaii and hear kind of their background and history, as well as
Their perspective on what they're doing and also the future for agriculture in Hawaii.
So join us every Thursday. You can tweet in your own comments and suggestions and be a part of the conversation at Think Tech High. And we hope to see you every single Thursday.
Aloha and welcome back to Think Tech Hawaii's Education Movers, Shakers, and Reformers. Once again, I'm your host, Carl Campagna, and we have today our very special guest, Ms. Georgi DeCosta of Hawaii Meth Project. So once again, thank you. We did have a listener question, actually, and thank you very much for the listener question, very much. The question leads into this last segment anyway, which is, how is it that meth is so common in Hawaii? We are a chain of islands, 2,200 miles away. How is it so prevalent?
You know, and that's a really good question, because it really shouldn't be this way. If you look back at the history, meth came from Asia to Hawaii, and there are a lot of people that say that Hawaii was a test market for the drug trafficking organizations back in the late 70s, early 80s timeframe, to see if the Americas would take on, if the U.S. would kind of catch on to this methamphetamine thing. And we did. Because if you look at Hawaii's workforce, we tend to be generally a very labor intensive. Our people are working very hard.
Yeah, very hard.
And
very hard.
It caught on.
Especially going back into the generations when we look at the farm workers and the agrarian society that we were, and the sugarcane farms, and a lot of really hardworking people trying to make a difference for their kids.
Good people
Yeah.
doing good things, sometimes making a bad choice, and then other people who just trying to escape and using it to get high. So there's a mix of things going on there. So it was imported,
It's
right?
imported.
Imported, and then after another decade or so, Mexican drug trafficking organizations and others from the West Coast area started catching on and realized that they could make big money off of us. And that's typically where it comes from now. Most recently, it is now coming from both angles. The Asia side of things is coming back into the game.
Mexico.
So with Hawaii being a big time import, you know, our hinode rice, our toilet paper, so many things is imported here. They're importing
So
into,
it makes it so that the pathways are there.
Correct.
And it's easy access in that regard.
and there are so many law enforcement agencies working extremely hard on this. They really want to stamp out this methamphetamine import business. But, you know, it's big business on the drug trafficking organization side. So if they send in, for instance, 20 different routes, maybe the police get 3 routes,
Get
and they
some of
think,
it,
wow, you know, they did a good job, but
Wow.
there's so many more. And I'm just, you know, that's just my own hypothesis, just so, you know,
Yeah.
for instance. But it's somebody far away
So
is
this
making
is one
money.
of the challenges.
This
When
is a
it-
huge challenge.
One of the challenges is there are multiple directions and then multiple paths that they take in order to get it here.
There is so much meth on the streets. It is so cheap. It is so readily available. It is high quality. much better than on the mainland. The law enforcement very rarely has meth lab busts in Hawaii. I think there recently was a small one in Salt Lake the end of last year, but really not much meth being made here for mass production for distribution purposes, you know. Most of the meth being sold on the streets is import.
So that being one of the challenges, and that's a big challenge because it's prevalent, it's there, and it's cheap.
Yes.
And because we're hardworking communities, we look for a release.
Yeah. Well, and some other people just looking to escape.
Looking to escape.
Yes.
And of course, we've got the people who are trying to push it,
Yes.
which just makes that worse.
Yeah.
Yeah, it's heartbreaking, actually, when you think about your kids and the fear that we have that they might even accidentally not even be aware of, all of a sudden there it is. Yeah, that's...
And thinking about that, our families, our brothers, cousins, neighbors, sometimes good people making bad choices.
Yeah.
You love the person, not their behavior.
I think that's an important message.
Yeah.
I think that's an important message. You've had a couple of really good messages, and I'd like to sum some of those up at some point. All right, so what are some of the other challenges that you face as far as trying to make the program work, maybe?
Oh gosh, there's just not enough hours in the day. So we barely can get into all the classrooms. You know, a lot of the teachers want us to come in and do the presentations ourselves. That's just not a reality. There's not enough funding for us to do all of the work that needs to be done. I think we were into about 18% of our target schools that we would like to be in, and that's really, we have all of the schools in 7th to 12th grade on that list. And that's just not enough. We have amazing champion teachers that bring us in every year, every semester, across the state. But doing a statewide program is expensive. You know, air travel is not cheap.
You're entirely funded. Let me ask this question from a different direction. Do you receive any state or city and county funding?
So right now we have a state contract that came through a GIA.
Okay.
So we're very, very grateful for that, working closely with Department of Health, ADAD, Alcohol Drug Abuse Division. So they're a great team, and so we're working closely with them on that. But most of our funding over the 7 years has been private.
Private funding. Well, thank you for the private funders. There are a number of areas where private funding has come in really over the generations, this being one obvious good choice.
The other thing that people don't understand what we're doing, or they're the perception issue. Some of the schools may not understand what we're about. We're a prevention organization. We're not coming in to say that your school has an issue with drugs or meth at all. We're coming in to help your students be a part of the solution.
It's an awareness program. It's
yes.
similar to, I remember in the 70s and 80s when I was in school, the posters up on the wall, the anti-smoking posters. So it's by the way, is that what you want?
Yeah, and helping them, we're trying to inspire the students to be activated and become advocates and get out there and say, hey.
Which is an amazing feat unto itself. And that's one of the things that, to me, from a programmatic perspective, one of the greatest successes that I can see that you have is that you get so many of these kids motivated and engaged.
And really, it's pixie dust. I have no magic plan or strategy how that works. We just, being that we're so small, we're able to empower the teens in a whole special way.
They do it.
And they do it.
So these teens they're leaders. Your council is a council of leaders.
Yes, and we train them intensely. We give them tools, and we support them to succeed. And that's our job.
In order to get enough funding to get to all of your target schools, it's a big number, a big amount of money you would need in order to achieve that. Well, that not being an easy wave of the wand, here's your money, that's one of your challenges.
That's a huge challenge.
Is there a way to integrate with not just Department of Health, but Department of Education and have it be part of a core curriculum piece?
You know, I think that's always a possibility. I think certain pieces definitely could be a part of the integrated as a part of those institutionalized. I guess it's that's looking for the long-term sustainability is always the golden egg.
Yeah.
And we're always looking to talk to people about that.
What's your carryover from these teen councils? Do they all stay every year, or is it a one-year program? And so you're building.
We have them apply every year because we want, first of all, we want them to a graceful exit if they do want to do other things.
Okay.
We don't want them to feel obligated. They commit to 1 year, we give them 1 year. But also it's good practice.
Yeah, absolutely. But having to go through the process again.
Yes.
Yeah.
So, but then, we have right now 3 students that are third years. One on Kauai, one on the Big Island, and one here. And they're third years. And I tell you, the growth that we've seen in these students is amazing. Our Kauai student, we just were blessed with the front cover of Midweek Kauai. And I was just so stoked to see that because she's been with us since her sophomore year. And her first leadership camp with us, she didn't say a word. Miss Erica just sat there and was scared out of her mind. But now, in her third year, she trains all of her volunteers. She has taught us how to do volunteer training for our outreach booths. She's helped lead us in our Not Even Once club efforts.
She has bloomed.
She has blossomed. She did a whole summer internship with JAPSOM. She did staying over here in Honolulu with an aunt on her own. It was just it's
great.
amazing.
That's great.
And to
That's
think that we played a little part in that blossom.
In opening her up,
Yeah.
which is empowering. You are empowering her, which is absolutely wonderful.
Yeah, and
Absolutely
that's what she asked when she came to us. She said, I'm not the best student or the top performer, but I think I have more in me. Could you give me an opportunity? And we
there
did.
It goes. That's wonderful. That's excellent.
So, and that's, there is a lot of carryover this year. Unfortunately, I think we have 14 seniors. So it's definitely a lot of graduations we'll be attending this year. But we're proud of every single one of
recruiting a
them.
whole new batch coming up soon.
Absolutely.
Yeah. Well, that's excellent. Okay. So, unfortunately, we have to wrap up. There's, I don't know, about a dozen or more questions I would have just off the top of my head, let alone what I have written down here. Okay, solutions for this. One of the solutions is this, and this is a good way to wrap up. How do people get involved?
It starts as simple as it doesn't even have to be get involved with us. Get involved with your school, your student. Talk to them, your child, your niece or nephew, your grandchild. Ask them, and it's not just about telling them, don't get high. Just listen. Say, hey, how's things going? What's going on around school? What are your friends up to? Just listen and see what they say. If you're not sure what to talk about, go visit our website, hawaiimethproject.org. On the Ask section of our website, there's 26 of the most commonly asked questions about meth. Educate yourself if you're not sure. The Coalition for a Drug-Free Hawaii has tons of resources about all the rest of the drugs out there. They're a great resource for all those other things that, ecstasy, pills, all those other things that parents are worried about.
Yeah.
Visit them. They have tons of resources and a library in Nimitz, so if anyone wants to visit those. But HawaiiMethProject.org, we also have a Break the Ice art contest. Please check it out.
I was just going to...
February 12th is our contest deadline. We'd love to see the teens get involved. Encourage your teen to get involved. Learn something for yourself, show it to your teen, have a conversation, and encourage them to enter the contest. First prize in the various age categories is $300 in gift cards. Apple, we have Walmart, we have Amazon. So we want to get these teens to help us influence their peers through their art. So,
excellent. Okay. And okay. So that is your art contest called Break the Ice.
Break the Ice.
And when is the deadline again?
February 12th.
February 12th.
It's on our website, right on the home page. You can see the entry link.
Excellent, excellent. And it just saw the website up on the screen. So excellent. So, okay. Thank you again. this is a very important and special episode, and the message that I get is communicate. Talk with your kids.
The silence is killing us. We
Yes.
need to start sharing and show love and caring. Thank you.
Thank you very much. Thank you, Ms. Georgi DeCosta, Executive Director of the Hawaii Meth Project. Thank you to all of you. Again, I'm Carl Campagna. This is Think Tech Hawaii's Education Movers, Shakers, and Reformers. We will see you next week. Take care.